This question states, when entering orders using computerized physician order entry, or CPOE, what is the primary benefit? So when we take a look at this question and we see this computerized physician order entry, this might not be a phrase that you're entirely familiar with. You might have heard of physicians or providers using different types of software such as Epic or something else along those lines, but we could use the context when we see here the computerized and then an order entry. We could use that to interpret, okay, this is some sort of computer model that the provider will be using in order to put in orders for their patients. An order meaning medication order for prescription. So now let's take a look at the choices. The first option says it eliminates the need for paper prescriptions. Well, that could be a possibility because the provider is using a computer in this example, and this choice is stating paper prescriptions. But it does say eliminates, which means it's completely getting rid of it. It's not there at all. It doesn't exist. We're eliminating it completely. So it doesn't really seem that strong of an option, but it's something that maybe we're considering because it does state about not using paper prescriptions, and right here it's saying computerized. So this seems like something that maybe you would keep open. You're not eliminating it yet. You're not choosing it. Let's just look at the other options. Option B states it ensures that the patient receives the medication immediately. So whenever you're looking at these exam questions and you see terms such as immediately, something very strong like immediately or always or never, you have to be very careful because that's very strong and there usually is some sort of room for an exception. So when we see immediately receiving medications, that's not accurate because when the provider puts in an order for a prescription, it takes time to go through the pharmacy. They have to authorize it as well. You might remember from when you pick up your own prescriptions that you have to wait for the pharmacy to contact you to state that it's ready. Nothing really happens immediately. Even if it's a very stat order, that's a very strong term to say immediately. So I think that that is something that would be safe to eliminate. Looking at option C, it says, it reduces the chances of medication errors due to illegible handwriting. And this is something that we know to always be true because it says it reduces the chances of errors due to illegible handwriting. And that's a fact all the way around because if you're putting in the computer, you're not writing it, there's no handwriting involved. That's true all the time. In comparison to option A, where it says eliminating the need for paper prescriptions, the need for paper prescriptions might not necessarily be completely eliminated all of the time. There are some emergency situations, maybe if there's a worldwide computer outage, let's say, or if a patient really does need something very stat and we don't have the time to go through with the computerized. There are always some sort of an exception. So although you might have been stuck between A and C, C is actually the better option because that is something saying that it reduces the errors due to illegible handwriting. That's something that there's really no loophole in that. That's always true. If you're putting in the computer, you're not handwriting as you would on paper. So we could go with option C, and now we could go back to option A and eliminate that. But let's take a look at option D as well. Option D states it allows the physician to prescribe medications not approved by the FDA. And that's just the fact that's not accurate. They're just providing orders through a computerized system. It has nothing to do with whether it's approved by the FDA or not. So we could eliminate option D. So that leaves us with option C as our choice. It reduces the chances of medication errors due to illegible handwriting.